Hi, I'm Summer. I'm the PA. So I heard you're having some concerns about a colonoscopy screening that's recommended. I just wanted to make sure you understand the importance of this screening procedure. It is actually recommended that everyone above the age of 45 gets a colonoscopy to screen for colon cancer. So since you're 50 and you haven't gotten one, it's definitely recommended that you get one of these procedures, whether you have a family history of colon cancer or any sort of cancer or not. I don't know if you know this, but colon cancer is actually the second leading cause of cancer-related death worldwide. So it's really important that we catch it early on. And a colonoscopy is the best way to screen for the disease and catch it in its early stages so you have the most successful treatment as possible. I know that this procedure does not sound like the most fun process, but the benefits definitely outweigh the cons. You are put to sleep for the procedure, so you shouldn't feel anything. It's like a really great nap. It's a safe procedure with very limited risks. Some of the rare associated complications can be like a GI bleed or perforation, but like I said, that's very, very uncommon. It only happens about like one in like thousands of people. So it's very unlikely that it will happen to you, especially if you don't have any risk factors. If everything is normal, you won't have to repeat the procedure for another 10 years. And if abnormalities are found, it is likely that it will be repeated in 3 to 5 years, but that exact time period is determined by the GI doctor doing the procedure. I know you were curious about alternatives, but like I said, there's no as good screening as a colonoscopy for colon cancer. There are some stool-based tests known as the fecal immunochemical test or the FIT test, the guaiac-based fecal occult test or the GFOBIT test, and then a stool DNA test or Cologuard, which a lot of people have heard about. The problem with these tests, there is like a high rate of false positives because they just look for blood in your stool. And if that is found to be positive, you'll need to get a colonoscopy anyways. And then another option is a CT colonography, which is where they like take a picture in a machine of your colon, but it requires the same bowel prep as a colonoscopy, which is probably the least favorite part of all patients is the bowel prep. So you have to do that anyways. And then this one you have to repeat every 5 years. And like I said, with a normal traditional colonoscopy, that is only repeated every 10 years. And the CT colonography may not be covered by your insurance. So I just think it's a really good thing that everyone above the age of 45 should do. You really don't want to have colon cancer. I know this procedure might not be the most enjoyable thing, but it definitely is very crucial for your long-term health that we catch colon cancer early on or make sure you don't have it. So I really would encourage you to get a colonoscopy done.